All right, good morning, everyone. Thank you for joining us for today's briefing. Today we will be covering our COVID-19 outreach briefing. So my name is Connie Nakano. I am the Communications Director for the California Department of Aging. So just to go over a few logistics off the top as folks are still entering into our webinar. So reminder, participants will be muted during the presentations. You can use your raise the hand icon during our Q&A portion, which will be towards the latter part of the hour to request your line to be unmuted. Closed captioning is available. You can access that by the icon at the bottom of your Zoom screen. You can also join us in the Q&A throughout the presentation. The Q&A function is enabled and you can share your questions and comments using the Q&A icon at the bottom of your Zoom screen. This presentation today is recorded and also will be archived on CDA's YouTube channel. So we've got a packed agenda today. So we'll be going over some COVID data. We'll also be briefing you on our COVID vaccine outreach. And then we'll have additional resources as well. And then we'll head into the Q&A. So now I'd like to introduce you to our Director of California Department of Aging, Susan Dormoris.
Thank you so much, Connie, and good morning to everybody. Thank you for attending today's briefing. I'm closely monitoring the registrants. We have 423 participants on with us, including a number of representatives from various state departments. Thank you all for being here and preparing today for this important topic. While some COVID restrictions have been lifted and many begin to return to normal, there is still a population that remains susceptible to the COVID virus. And it's important that we continue to encourage them to get vaccinated, get boosted, and stay current. Today, you will learn about the most recent COVID data and how all of our participants are being impacted. You'll hear what outreach efforts are in place in close collaboration with the California Department of Public Health and our sister departments across the California Health and Human Services Agency that serve older adults and people with disabilities. That would be the Department of Social Services, the Department of Developmental Services, the Department of Rehabilitation, and the Department of Healthcare Services. We'd like to encourage you to join us in continuing to spread these important public messages to older adults and people with disabilities so they can safely be reintegrated into their communities. I would like now to turn it over to our colleague from the Department of Public Health. Welcome, Aubrey Fong.
Thank you so much, Director. Good morning, everyone. So happy to be here with all of you on this Friday morning. My name is Aubrey Fong, and I'm with the California Department of Public Health Vaccinate All 58 campaign. So just want to open this morning by sharing a little bit of vaccine administration information, as well as some numbers that we'll share with you shortly. But a quick at a glance, these numbers were captured yesterday. We've got almost 75 million vaccines administered, and then you can see there the breakdown of fully vaccinated and partially vaccinated. So we're at about 75% of the of fully vaccinated of those that are eligible. Next slide, please. So here, just wanted to also give a snapshot of primary series completion by age group. And this information is all available on the COVID-19 vaccine data dashboard. So this is, you can break it down for the whole state, so statewide information, as well as by county. And then in the drop-down boxes, you can also select different categories. But here wanted to give a breakout of the primary series completion by age group. So you'll see here also a breakdown of partially vaccinated and not yet vaccinated of those that we have record of being eligible to be vaccinated. And here you'll note that the 50 to 64 age range is 84.1% vaccinated of the 7.4 million that are eligible, as well as 84% of the 65 and over population. Next slide, please. Also, just a quick update about booster doses. We've come into some new eligibility and expansion of booster doses. So just wanted to help everyone here with a breakdown of who's eligible for the first, who's eligible and recommended for the first booster dose. Everyone age 12 and older should receive a first booster dose after completion of their primary series. And a second booster dose is available for those in vulnerable populations who are most likely to benefit from an increase in protection against severe illness, hospitalization, and death. So there will be some information, FAQs linked in the outreach section that we'll go over a little bit later. Next slide, please. Also wanted to give a quick snapshot of vaccination status by group for boosters, so booster completion by age group. Here again, you'll see the breakdown of those that have received a booster and those that are eligible but have not received a booster. So for age group 50 to 64, we're at 64.9%, and 65 and over, we're at about 74% of the population, eligible population. Next slide, please. Here also is just a quick breakdown of booster completion by race and ethnicity, as well as age. So, you know, these are obviously very general race and ethnicity groups, but gives you a quick glimpse there as well of the breakdown between race and ethnicity. And again, thank you for dropping the dashboard in the chat. All of this information is findable on that dashboard, and it's updated twice a week now. So you'll be able to go there, and there are many sections there that, as I pointed out before, you can select different groupings, and you can select count by county as well as statewide data.
Great, thank you very much for sharing the data, Aubrey. That's very insightful. And, you know, the data really shows that, you know, as, you know, restrictions are being lifted, and I think folks are starting to return to somewhat of normalcy, but there's still, you can see the population of older adults and people with disabilities. You know, we, like Susan said earlier, we want to encourage them to stay current, get vaccinated, and get boosted. Next, we want to go over, you know, there's been a lot of COVID vaccine outreach that we've been doing over, you know, this past year and continue to do. So we wanted to make sure we pulled it all together into an easy spot for you all to find. So we're going to go over where you can easily access some of these resources. So what we've done is we have a vaccine outreach campaign resource page. It can be found on CDA's webpage. You can link to it there, and I'll show you really quick. Let me go live so it's a little easier to demonstrate. But we wanted to make an easy one-stop shop so that you can find all the resources available to encourage older adults and people with disabilities to continue to stay current. Let me share this really quick. Okay, so when you come to the CDA webpage, and again, we'll drop all the direct links in the chat, and we'll also have it available in the presentation with the direct links as well as a follow-up. Here we have a page, and you'll see all the resources will be listed here. So I'll go over what CDA's campaign components have consisted. We've uploaded a lot of our creative, a lot of the messaging that we've been doing, and our media plan. Later, you'll hear from some of the efforts from healthcare services, and also Department of Social Services as well, and also Department of Public Health. So you'll be able to access all the toolkits. So let me walk you through some of the items that the California Department of Aging has been doing for COVID outreach. So we implemented an outreach strategy that supported older adults and people with disabilities. And this was an ongoing effort that focuses on highly targeted areas with localized message geared towards low vaccination and booster zip codes. So here, if you'd like to take a look at our media flowchart, you know, and if you want to kind of piggyback off of some of the synergy that we've got going on with our statewide campaign, here's the year laid out in terms of how we've placed some of the ads and the messaging. And you'll see the weeks that we have advertising going. So, and which markets that it's in. So if you wanted to find out a little bit more information and piggyback a campaign off of that. you're welcome to do so. There's also just more information about all of the different avenues and channels that we are using in our campaign. So our overall media strategy has focused on vaccine and booster messaging with utilizing broadcast radio and television support. We also utilize, sorry, am I driving it right now? Sorry, just a minute. I'm wondering, let's see. Can you guys see my screen? Huh? Okay, okay, great. Sorry. I thought I was driving the screen for a moment. My mouse wasn't following me. Okay. So what you're seeing right now on screen is the media flow chart. Nelson, if we can go back to the page and we can walk people through the creative. Thank you. Okay. So just want to give you a snapshot of some of the components that we've been utilizing. So here's our direct mail campaign. And this was utilized for highly targeted zip code outreach that we did. If you click through it, you want to click on that? Yes, thank you. So what we have here is we have a lot of resources available for a lot of our direct mail outreach that we've done. You'll be able to see all of the pieces. They've been designed in English and Spanish. You can actually download the creative and you'll see the source files if you'd like to customize the pieces. We actually do have some printed pieces available as well for stakeholders to order. So postage is not included. So if you'd like to mail them out, you would need to attach postage to it. But if you would like the physical printed pieces to be able to distribute, we do have those available, and there's an ordering portal through here, and that's at no cost to you as a stakeholder. Back to the main page. Okay, now going through some of the radio and TV creative that we have utilized for our campaign. Again, you know, we were utilizing the radio and TV assets. So you'll see a various of different spots here listed. So we've got them all in English and Spanish, but you can click through those and download and utilize them as well if you'd like to run a campaign, or if you want to see what messaging that we've been using. Let's go down a little further. And then there's also some other assets for social media and additional print assets as well. If there's social media posts that you'd like to use for a campaign or reshare, we encourage you to also, you know, follow us on all of our Twitters, Facebook, and our platforms to reshare some of the messaging we have out. Here's another piece that you see on screen. If you'd like to download the creative to utilize, or if you'd like to print it out, that's available as well. And then we also had an ethnic media component where we hosted ethnic media briefings and also utilized ethnic print platforms as well to encourage vaccination and boosters. So now we'll go to additional COVID outreach. I will turn it back to CDPH. So Aubrey, if you'd like to walk us through some of the toolkits and resources that CDPH has for COVID outreach.
Absolutely. Thank you so much, Connie. Are we bringing one of the pages up? Thank you. So sorry, it's very small on my screen. So first you'll see the state dashboard. Thank you so much. I appreciate that. So first of all, just piggybacking off of what Connie said, thank you all so much for your help in sharing these resources and going to these resources to find the latest outreach and education material available. Really appreciate everybody stepping in to help share out this information. First, you'll see the state COVID-19 dashboard, which is the dashboard that we pulled some of the information from that we showed you earlier on the data pieces. And next is the Family and Kids Sprint Toolkit. And that is actually an effort that we're in right now. I believe we're in the third week of our Family and Kids campaign, which is really aimed to help outreach to more families and kids, youth under 24, as we're a little bit lagging in the 5 to 17 vaccination rates. So there you'll see, sorry, in the toolkit there, you'll see sample newsletter drafts, as well as some creative social media assets that you can share out. We did break down our 8-week campaign into themes so that we could partner with some of our amazing statewide partners and agencies. But again, most of the stuff that's in the toolkits is very shareable across the board. And then the masking and COVID-19 toolkit, a lot of questions as masking guidance changes. So just want to keep providing material to encourage masking as appropriate and to keep people up to date on masking information. So here you'll find fact sheets in several languages, as well as tips on best fitting masks and customizable flyers for you all to use, and social media assets as well. Also leaning into kindness for our masking social media graphics as kids go back, or kids are in school and masking guidance changes again. Heard from our education partners that it's important to have those tools for kids masking as well. And then the PostCovid Toolkit has some information about long COVID and some other post-COVID or long COVID conditions, as well as some, video assets that you can share out as well. These can all be found on YouTube. So just sharing messages of people experiencing long COVID in case it's helpful. It is one thing that we are trying to talk more about. COVID-19 has definitely gone through a lot of ups and downs as far as how it's affected our communities, but long COVID, we are learning more about long COVID, and so trying to share out more information on that as well. And then, as I referenced earlier, CDPH booster guidance. So here again is some information on what the current guidance is, as well as question and answers, I believe in Spanish and English at least, but you can find additional booster guidance information there. And then the last two links are signups for two of our newsletters that come out. The Vaccinate All 58 newsletter sign up is directly from our campaign with vaccination updates. Also provides updated information that you'll see here. Or I'm sorry, that's in addition to what you see here. New toolkits, new guidance, updates, anything related to vaccines. And then also a sign up link for the CDPH newsletter. So that has a lot of helpful information about a lot of all public health matters for all Californians. So we encourage you to please sign up for both to stay informed on all things public health and vaccination related. Thanks so much.
Thank you, Aubrey, for walking us through all of the resources from CDPH. Next, we're actually going to go to social services. We have Laura Felicina and Kimberly Lewis.
Thank you, Connie. My name is Leora Felicina. I am the Deputy Director of the Adult Programs Division. We oversee the in-home supportive services program. For the purposes of this meeting, we actually do mostly direct communications to our recipients and providers. So we do have information on our website with regards to COVID. We post all letters and communications that we have sent out to our folks, but we also use social media as well. So we do use Facebook, and we actually leverage a lot of the resources you've already seen presented by the Department of Public Health, our sister departments. We utilize those resources and send them out through our social media. We also link to them through our electronic services portal, and we utilize other types of automated ways of reaching our population, including direct calls, emails, and we work with our stakeholders as well. They also provide us a lot of support in getting the information out there. So that's pretty much how we're approaching COVID and the vaccinations and getting that information out and trying to encourage people to be vaccinated, both recipients and providers. And I'll go ahead and hand it over to Kimberly.
Thank you, Leora. Hi, everyone. I'm Kimberly Lewis. I'm the Interim Assistant Deputy Director with Community Care Licensing Division. And in my position, I have oversight of the Adult and Senior Care Licensing Program, which serves over 299,000 Californians. And so we have been actively working with licensees to ensure the mitigation and prevention of COVID-19 in our facilities. We have issued regular provider information notices. So anytime that there's a change in CDC guidance or Department of Public Health, state public health orders, we do issue that guidance out to our facilities so that they have the most up-to-date information. And we also hold provider informational calls every month, and that's on the third Wednesday of every month. And the way that we get that information out to individuals to attend is by sending out provider information notice. And these calls are specifically for licensees and staff so that they understand the changes that are coming. It provides an opportunity for Q&A so that they can ask questions and get clarification on the guidance that's coming down. And again, really important for licensees and staff to be ensuring that people in the facilities are up to date and getting all of the most recent guidance. So I would encourage anyone that is a licensee or interested in information about these licensed facilities in relation to COVID-19 to sign up on our website, and you can go to www.ccld.ca.gov, and in the right-hand column, click on, there's an important, it says receive important updates. And there you can enter your email address, and any of those provider informational notices will come to your email. And you know, as we know, residents and staff in long-term care facilities who are 50 years or older or immunocompromised are at high risk of getting seriously ill with COVID-19. So therefore, it is encouraged that all residents and staff receive their vaccination, their primary series, and their booster doses. We encourage licensees of these facilities to be proactive and arrange for access to the vaccines and the booster doses for their residents and for their staff. There are some steps that licensees can take. We encourage them to reach out to their local regular or contract pharmacies to inquire about meeting the facility's needs. And, you know, again, being proactive and getting that. Also, the fastest way for residents of these facilities and staff to get vaccinated is if they're able to get out in the community themselves, to either go to nearby pharmacies or healthcare provider offices. That is the quickest way. But in some cases, we do have residents that are not able to leave. They may be bedridden. And in those cases, encourage the licensee to work with their local, again, pharmacies and try to get that on-site vaccination clinic. And then again, anytime that a licensee is having difficulty in obtaining vaccine access, we would encourage you to call our licensing offices. So the regional office that you would normally work with, so that we can assist. We do work with local public health in all areas, as well as the state public health, in order to get those vaccines out to the facilities to ensure that everyone remains safe. So those are some of the things that we're doing to prevent and mitigate COVID-19 and to ensure that people are vaccinated in our facilities. Thank you.
Thank you for that information. We'll make sure that all the information, especially the links that you had just brought up, we'll put it in the chat, or we'll also make sure that it's on the webpage and sent to folks that are participating today. So next we're going to move over to healthcare services. Dr. Karen Mark, lead. We're going to talk about the outreach efforts from Department of Healthcare Services.
Sure. And I am going to try and, do you want me to share my screen, or can someone else share the link that I put up?
Yeah, either way. Is it, do you want to share your screen with the page? Is it a link that's on the resource page?
It's a link on the research page, yeah.
Yeah, we can share it. Nelson, do you mind sharing the screen?
And that's the CDPH link.
Is the COVID response page link the one?
Yeah, try that one. Yeah, click on that one. Perfect. There we go. So thank you all so much and good morning. I'm the medical director at the Department of Healthcare Services and doing a lot of our coordination around our COVID vaccination efforts. So this is our COVID vaccination or our COVID response page, which has a whole portion on vaccines, as you can see at the top left here. At the top right, you'll notice that we link to many CDPH resources. So most of the resources that are on our webpage are geared primarily towards our managed care plans and providers. But, you know, as you've seen, CDPH has a lot of really great resources geared towards both providers and folks needing to be vaccinated. So we provide those links on our webpage in part because our plans can just use those resources directly without obtaining separate approval for DHCS, which they would need to do if they used a resource that they had developed themselves. In the vaccine portion here on the top left, this is where we post all of our vaccine information. So we post Medi-Cal COVID vaccination rates every month. We update those. We also have posted the all plan letter that describes our vaccination incentive program, which just has completed, but provided incentives to both patients and plans for getting vaccinations and boosted. We also have vaccination administration FAQs for both beneficiaries and for providers. And we also have a general all plan letter on COVID vaccine administration. And then I'll just point out here that we also have sections more specifically for beneficiaries and members and more specifically for providers and partners. So if you're a provider, say, or a partner, if you look in this area, you'll find additional COVID resources, and you can also find additional COVID vaccine resources. And then if we have additional resources, if you click on the view all in the top left there under vaccines. Thank you. This lists all of our vaccine resources. So for example, we also have COVID vaccine promising practices for health plans. This is where we put some of our best practices that health plans have been doing to encourage vaccination and posted them there to share. And a number of other different guidance for various types of providers. So that's just a quick overview of the resources we have available. With this, I'd like to turn it over to Yinja, who will be presenting on some of our resources around eligibility.
Hi, thank you, Dr. Mark. I'm going to screen share some of my slides for the group. Let me know if you're able to see them.
Yes, we can see them.
Okay, perfect. So hello, everyone. I'm Yingjia Huang. I'm the Assistant Deputy Director over Healthcare Benefits and Eligibility. Very happy to be here today, so thank you for the invitation. I'm here to share a little bit about two different initiatives. One is on our older adult expansion. As many of you know, in last year's or in the budget, in 2021, we have an exciting expansion to our individuals over 50 years of age and older, regardless of citizenship or immigration status, where we will be expanding our coverage from the limited restricted scope of Medi-Cal coverage to full scope Medi-Cal coverage, which includes the full breadth of services as it relates to medical care. And the implementation of this initiative is actually in a few days, May 1st of 22. So right now the department is working to ensure that we are transitioning all the individuals that are currently in our restricted scope program that are 50 years of age and older to full scope. And we do have some policy guidance, which we have administered to share with our counties who are very experienced in this type of transitions. For many of you who've been kind of following our expansions, eligibility expansions, we have actually done it in segments. In 2016, we expanded coverage to children under the age of 19. And just previously in 2020, we have expanded that to all young adults through the age of 25 years old. And specifically, we have two populations that are over 50 that we're looking that are impacted by this full scope expansion. One is our new enrollee population, who are new individuals coming into coverage on May 1st, meaning on May 1st, the doors are open for any individual over the age of 50 years old, regardless of your immigration status, to apply for full scope coverage into our program. And the second population being the transition population, which I previously kind of talked about, where they are currently enrolled in our restricted scope program, which we are sweeping and administratively moving them into full scope coverage. And both of these populations will be, the policy will be effective and effectuated May 1st, which is in a couple days, so very exciting. And DHCS will be monitoring the transition and also any new applications that come in, just to do a lot of our policy oversight of this new policy, and very excited that this is occurring. And from an outreach perspective, we know this is a very important initiative. And so we have developed an outreach toolkit. We're calling it a global outreaching messaging for our older adult expansion. It's also posted on our DHCS website, so I'm happy to share these resources. And this language toolkit encompasses language that's been tested, user tested, that you can use and brand in your social media, in notices and flyers, and they're all in the 19 Medi-Cal threshold languages. And so this is going to be very important for folks to know that there's this new policy out there that could actually help them. And please apply and go to your county, apply online for coverage if you don't already have any medical coverage. So this is also something we can also share. And this is currently live on the DHCS website, and I can share those links with our partners at Department of Aging. And secondly, this is also very exciting, as many of you know, we are currently still in the COVID-19 public health emergency, and we have been in this COVID-19 public health emergency since March of 2020. However, the status, which basically pauses all Medi-Cal redeterminations for our beneficiaries, will eventually resume. Currently, the public health emergency is extended through July of 2022. Since Medi-Cal is full month of coverage, the federal date is actually mid-July, but Medi-Cal offers full month of coverage. Once the public health emergency ends and is declared terminated at the federal level, all states will have to react and begin our work to redetermine the full Medi-Cal caseload. Currently, Medi-Cal has 14.6 million individuals that we are covering in our program, and each and every single one of these individuals will need to be redetermined. They have not been redetermined since March of 2020. And with the redetermination process, we are just making sure from all facets and all channels that they are aware that the normal processing will begin again. So we have developed an initiative called the DHCS Coverage Ambassadors, which we're very excited and have rolled out early this month. And we're encouraging our community partners, our state agency partners to sign up to help and join our mailing list, where we'll be providing you very updates once we receive them, and also pushing out communication toolkits for you to use, very similar to our older adult expansion toolkit. This toolkit will actually have graphics, DHCS approved language, flyers that our partners can use in their local materials. And that's really to help all our beneficiaries gain that awareness that most likely they will be getting a renewal packet in the mail. But we are kind of kind of developing this campaign kind of in two phases, since many of them have probably moved across the state during the COVID-19 pandemic. And we know that from our mail that we have sent out to them with the return rate percentages that have come back to the department, that the most immediate need is for them to update their contact information with the counties. If we cannot find these individuals when we send out the redetermination packets, many of them will be discontinued for whereabouts unknown, and that's what we want to avoid. So this coverage ambassador initiative will include all these toolkits where we will include, where we have included lots of social media language, graphics, where folks can publish in the provider clinic offices and their call scripts and website banners to help the matter. And phase two, actually, we're looking to commence 60 days prior to the federal COVID-19 public health emergency termination. So that actually has not been shared out broadly yet. And so we're still working on this internally on phase two, but we look to publish something very similar to our phase one toolkit, which is currently already on the DHCS website. And again, the core messaging for phase two is please make sure you're looking out for the renewal packet in the mail that's coming to you. And they need to respond to their counties in order to continue their coverage. So that's my updates. Happy to check in to see if there's any questions I can answer for the group.
Great, thank you both for all that information. All the information we'll make sure is on the resource page and also available to all of the participants today. So if you guys have any questions, feel free to use the Q&A function at the bottom of your screen. There's a lot of questions coming in, so we're trying to get most of them answered. But if you have any questions pertaining to anything that's been presented today, particularly on the outreach efforts, please feel free to drop it into the Q&A and we'll try to get that answered. Also, we'll be launching into our Q&A live section as well. So if you'd like to raise your hand and click the raise your hand icon at the bottom of your screen, we'll unmute your mic and you can ask your question live when we get to that portion. So now we're going to go to Nelson Shea from Department of Aging. We'll go over some additional COVID resources that we have outlined on the page.
Great, thanks, Connie. I'm Nelson Shea, a communications manager at the California Department of Aging, and I'm going to walk you through a few additional resources related to older adults. So beginning with the Department of Developmental Services, they provided links to vaccine and testing information, a data dashboard, and COVID-19 information and resources for adult and senior care facilities. Moving on to CDA's resources. So May is Older Americans Month, and this is the perfect time to lift up the older adults in our lives and to honor them for the role they play as mentors and creators and how they strengthen California by sharing their wisdom experience. To celebrate this, CDA has developed an Older Americans Month social media toolkit. It includes graphics and copy and various resources that focus on programs and services that empower older adults to remain independent and age where they choose. And below that, we have 2 inclusive age and ability-friendly style guides and language guides to reference when developing messaging and content for these audiences. And last, I want to invite you to please subscribe to CDA's newsletter. We'll drop it in the chat. This is a great way to receive information about CDA programs and initiatives, as well as the Master Plan for Aging. And of course, follow us on our Facebook channels, our social media channels. That would be Facebook, Twitter, and LinkedIn. And with that, I'll turn it back to Connie for questions and answers. Thank you.
Great, thank you for that information, Nelson. So now we're going to move over to our Q&A portion of the hour. So thank you all that have been submitting your questions through the Q&A chat box. We have gotten some of those answered and others are still coming in. Again, if you'd like to ask a question live, please feel free to hit the raise your hand icon at the bottom of your screen and we will unmute your microphone and you can ask your question live. I'll go to one of the questions that came in through the Q&A regarding use of our logos on any of the toolkits. And So any of the toolkits that are available, I believe you're able to put your logo on it. And those that do have toolkits, public health and healthcare services, correct me if I'm wrong, but the toolkits are designed in a way where you are able to download those assets. And if you'd like to add your logo to it, you're welcome to do so. If you have any additional questions about the toolkits specifically, you can reach out to us, CDA, or any of the owners of that specific toolkit, and we can help walk you through on how to apply your logo or any questions that you have. So it looks like we've got a few hands raised. Let's go to the first one, Katie Krull. We'll unmute your mic and you can ask your question live.
Yes, good morning. Thank you very much for very, very informative webinar. My question is about medical eligibility based on assets. Are there any deadline or the timing when the assets is not going to be considered anymore for medical eligibility?
Connie, I can certainly answer Katie's question. Hi, Katie, this is Yingzhe. So the Medi-Cal asset limits, we are doing it in 2 phases. On July 1st, we will be increasing the asset limit to 230,000. And in January, by January 1st of 2024, actually on January 1st of 2024, we will be eliminating the Medi-Cal assets per the statute. And also, just to maybe add a little bit, we are on track for the increase in asset limits. That's going to be in about 2 months.
Great. Thank you for that question, and thank you, Yingzhe. I think there's a follow-up question probably to that, Yingzhe, that I see in the Q&A box, and I believe they're referring to the eligibility redetermination of that program, and some of the flyers and social media posts on the outreach toolkit are not yet translated. Any idea on when the remaining translations and the phase toolkit will be available?
Yes, absolutely. Thank you for the question. We are working with our translation vendor to get this live as soon as possible, and I'm anticipating about 2 weeks.
Great, thank you. Okay, we'll go to our next participant with their hand raised. Let's go to Liddy Barnett.
Sorry. Oh, sorry.
Yeah.
I think I was triple muted. I had to press it 3 times. Good morning, Connie. This is Liddy with HealthNet. Wanted to find out so we can inform our members and our agents and everybody else really. As far as the websites, I know that in the past, each county has their own website, like for example, Your Benefits Now. And I saw an email come across with the new website. So my question is this, with everybody changing addresses and having to update, I'm really trying to help our members to get tech savvy and help them to update their own stuff. And so when are the Your Benefits Now or CalWin in Orange County, when are those going to be disabled, if they are going to be disabled, and how does that parallel with the new website?
So that question is, does anyone on the panel, are you able to answer that?
Connie, I think I could take a stab at it, Liddy. If not, if you could certainly email me just to make sure I'm not as close to the kind of the Benefits Cal piece. But I think you're referring to the Benefits Cal portal and the migration of or the movement of the CalWin County, which I know you mentioned Orange County as well, which is also a CalWin County, will be migrating over to Benefits Cal. Carney, I know it's on track. I don't have a timeline. I know it's going through in waves. So we are anticipating the full migration of all CalWin counties to the Benefits Cal platform, as well as the CalSOS platform, by October of 23. And certainly if you have something more specific that I was not able to answer, please feel free to send me a note and I'm happy to follow up.
Okay, so it sounds like yes, there's going to be one at least by October 2023, and then you're just phasing it out. Okay, good. That helps me to help our members because I want them to be all on the computer.
Yes.
As a matter of fact, we have classes for that. So thank you.
Got it. Absolutely.
Great, thank you for that question, and thank you, Yingzhe, for answering that. Okay, again, if you have any questions related to any of the materials that have been presented today, particularly on the outreach components, please drop them in the chat, or you can raise your hand and ask your question. We want to try to keep most of the Q&A to more of the outreach focus portion of today's event. I know we're seeing a lot of programmatic questions about some of the programs, and we'll make sure those go to the appropriate department so that you can get your questions. But today we really want to be answering any of the outreach questions that you have regarding any of the outreach efforts for COVID on the vaccinations and boosters. So next, let's go to, let's see, Patricia DeCamp. We'll unmute your mic and you can ask your question.
Connie, real quick, I forgot to thank you for this outreach. This is why I joined. Just to share something personal, my sister passed away of COVID 6 weeks ago. And so I am very encouraged by, just as a state, we're reaching out to our folks and we're saving those lives. So thank you for that. Super appreciate you.
Thank you very much for that comment. And we're sorry to hear about your sister's passing, but thank you very much for that comment.
Thank you, Connie. This is Patty DeCamp. I'm very sorry to hear, when people are passing away from COVID. It's a very sad situation. I think everybody has been facing that one or another. We know somebody closer to us that have sadly died from COVID, and we're fortunately to have the vaccine available. My question is, like you say, about the outreach materials, and I think somebody already answered, but I just want to make sure, because I hear a lot that it is in Spanish. A lot of flyers are in Spanish, and the majority of the information is in Spanish. Are we offering other type of translations as well, like Armenian, Chinese, that kind of translation on the outreach materials?
I believe some of the outreach materials do have multiple languages translated. And Aubrey, are you on? I believe I've seen in the toolkits that public health has, there's various languages in there.
Yeah, thanks, Connie, and thank you for that question. There are some of the material is definitely provided in multiple languages. If it is provided in more languages, you'll be able to see the link when you click on the guidance or the toolkit. It will pop up and either be in a folder or in a separate link by language. And I believe some of those are available in up to 14 languages.
Thank you very much. Thank you, Connie. Thank you, Aubrey, for the answering my question.
Yeah, of course. Thank you.
Okay, we'll go to the next participant, Palomo Espino. We'll unmute your microphone.
Good morning.
Good morning.
Part of I work for Sarah House. We do hospice care. Part of our challenge is that our community changes often. And we ran across the first issue with the vaccines that I had signed up 8 people. And by the time the clinic came around, 5 of them had passed away. The folks still do want to get their booster. Each folks comes with a public hospice agency, but I am told by the agencies that they don't have a way to give them the booster. Is there any way that we could figure out how to do that? Most of our patients are either bedbound or frail because they're on hospice. And the time that they decline sometimes is quickly, and sometimes they're with us for a year. So it's super difficult to make a plan, but getting them out to a regular pharmacy is not a good option for them. Any ideas?
Yeah, in terms of being able to get them an in-home appointment, and Aubrey, I'll look to you again, but I believe if you go to the My Turn website or call that number, I believe an in-home appointment can be made. So I would direct you to that as a resource to take a look and see what options are there for individuals that aren't able to make it to a physical site.
Okay. Last time that I did, said that we needed at least 10 appointments, but our little house is only 8. And out of those 8, not everybody is up to taking it, or they've declined so much that there's no way that they would get any benefit from it. So let's say I may have 8 residents and 3 of them are ready for an appointment, which is not like sometimes not even that same week, and things change quickly. That's kind of the challenge that I'm seeing. It would be way easier if we could connect with the hospice agency. They have nurses and doctors. If they would bring it in to their patients individually, that would be awesome. But do we see any situation like that coming up?
I'll just speak really quickly to, I'm not sure about the hospice agency opportunity, but for if My Turn isn't, if you're not able to get the services that you need through My Turn, the in-home or in-care appointments through My Turn, I believe you can also reach out to your local health jurisdiction, and some of the local health jurisdictions also have in-home appointments available.
Wonderful. Thank you. I will try them as well. Thank you so much.
Of course.
Thank you for that question, and thank you, Aubrey, for that. So I did see a question in the chat or in the Q&A box regarding asking if there are any materials for low vision. And we actually do have in our direct mail pieces. If you go to the ordering portal, we actually have Braille versions available as well. So if you'd like to order those to use or to distribute, those will be available as well. Oops, there we go. There's a screen share. So you'll see here on the portal, you can order there. There's a Braille version. So there are pieces available if you'd like to order those. And if you need more quantities, let us know and we can help see how we can get you some. All right, let's go to one more live question. Arthur Gamboa. We'll unmute your mic, and if you'd like to ask us a question regarding anything that was presented today or regarding outreach, we'll unmute your microphone. Arthur, are you unmuted?
Sorry, I might accidentally press the button, but I don't have any question, and yeah, it's okay. Thank you.
Okay. All right, so it looks like if anybody has a question, feel free to hit the raise your hand icon if you have any questions regarding any of the outreach materials that we've discussed today or any outreach questions. You can raise your hand, or you can feel free to drop your question into the Q&A box. Again, today's presentation has been recorded, and the presentation will also be made available online so that you can access the actual slides that were presented today. And then also all the resource links you'll be able to access as well. So as we're waiting, so we've got a few more minutes that we'll wait and see if there's additional questions where somebody wants to ask live, or if you want to drop your question in the Q&A box. It looks like we're still answering a lot of the questions and we're getting through most of them. We're going to run a few polls. So Nelson, I'll turn it over to you if you want to put up the poll question. Okay, thank you. Here we go. So we're just kind of curious, more information on the content geared towards older adults. You know, would you like to see and have access to more COVID-19 outreach content geared towards older adults and people with disabilities? You know, it's a, mark yes or no. We just kind of want to take a little bit of information on what folks are needing. It looks like a lot of folks are interested in more content geared towards older adults and people with disabilities. And we really welcome any feedback and any suggestions you may have regarding some content that you may want to see that you haven't seen available yet, you know, that we'd like to open that collaboration with you all as stakeholders in terms of what messaging and what pieces maybe need to be created, because once it's created, we'd be able to share it out with everyone. I think we have another poll question we can put up. Let's see. Did we have one more poll question? I think that question was just put up. There we go. You know, we'd like to know if you guys found today's event helpful. You know, I think this was one of the first events that we put together that had more of an outreach focus, and we really wanted to share a lot of the work that we've been doing collectively as departments together. So we'd like to know, you know, if you found this event helpful, slightly helpful, and give us any, you know, honest feedback, because this would just help us, you know, kind of get you more information that you guys are looking for. And again, if you have any questions, feel free to continue to drop it in the Q&A box. We see a lot of the questions are being answered. And then if you have any questions, let's see. It looks like the results of the poll, most have found today helpful. So I'm glad to hear that. You know, again, if you guys have any feedback regarding today's event or any information shared or information that you would have liked to see shared, you know, please feel free to send that feedback to us. I think that's our last poll question. So it doesn't look like we have any other questions coming in live. Some other additional questions have been coming in through the chat, and I believe those are being answered. So with that, share this really quickly. So I'm going to put up the email address that okay. So thank you everyone for attending today's event. We hope you found it helpful. You know, definitely we'll have all of the resources links. They're all posted on the page. We'll probably add some additional information that was presented today. We'll make sure all of the slides that were presented today, we'll put it all together and make sure that that's posted up on our website. And also there will be a recording of today's event. If you have any additional questions about today's event or anything that was presented that you weren't able to ask in the Q&A or thought of later, please feel free to email us, communications@aging.ca.gov. So thank you very much for everyone again for attending.